There is many reasons people might need to replace missing teeth, and Dr. Wilson of TLC for Gums is here to tell us the importance of replacing teeth and how easy it can be. And that's one thing that people don't realize. You do need your teeth, don't you? Even though you might have lost one or something.
Right.
And that's because your teeth shift in your mouth. It hurts, right?
Correct. So if you're missing a tooth, then the adjacent teeth want to shift into that space and take that space over, which sets you up for other problems. They're more difficult to clean, sets you up for periodontal disease, sets you up for tooth decay and things like that. So you really should get them placed.
Let's talk about, of course, TLC for Gums in your office and how great it is and how you guys are ready there to serve the community and everyone.
Okay. So what we do is we offer implants. Everybody comes in and not everybody needs an implant, okay? But the number one thing that we're going to look at is an implant because that's the most natural thing. It's most like replacing a natural tooth, okay? So we've got single implants. Somebody might be missing, say, 3 teeth in a row. We can put 2 implants in the mouth and then do a 3-unit bridge, for example.
Yeah.
Things like that. And so there are also sometimes people come in and if they're missing a tooth and there's decay on the adjacent teeth or large fillings or even crowns on the other teeth, then we might consider doing a bridge onto the natural teeth, okay? We also have things like removable partial dentures. We have people who come in sometimes and their dentures don't fit quite right, so we'll place implants in the bone and then have the denture itself retrofitted to the implants and it can just snap on there.
Yeah. And we've been looking at some of the pictures here on the screen. That's what I want, before we go any further, it has changed, and that's one thing you want to let people know right now.
Just lots of options.
Lots of options, but also too, I mean, I remember when my dad actually had to get dentures, and they were killing him. Like it was really hurting him and stuff like that. And that kind of scared me away from like, okay, going to the dentist and if I ever need to replace something. But, you know, with the new technology now, it's a lot different than when my dad got them, right?
Yes. Yes, sir.
So, and why is that? Just I mean, what you guys do is to make sure they're fitting right, correct?
The dentures?
Yeah.
Yeah, sure. I mean, we can reline dentures and that sort of thing. It's really important to get good impressions when you're doing dentures to make sure that the tissue is actually approximated inside the denture. So that's very important. And with the advance of new impression materials and even digital impressions, we can do a lot of stuff digitally now.
Yeah. Okay. So now let's go to the implants because there's a big difference between a denture and an implant.
Right.
Okay. So now the implant actually really goes into your teeth.
It's secured into the bone just like a natural tooth.
Yeah. So I think we have a picture here. I want to bring this up if we can. Okay. So that's what we're looking at right now, right?
Exactly. So as you can see, it most clearly mimics a natural tooth. We've got the implant down inside the bone that's just like the root, and then we put what's called an abutment on top of that and a crown on top of that, and it looks just like a natural tooth.
Yeah, and if we go to another one where you said you can either do one, right, or you can do multiple ones?
So here's a single implant right here. We can also, if that person is missing 3 teeth in a row, you could do 2 implants and a 3-unit bridge like you see right there. If you've got all the teeth missing, we can do multiple implants. This is like the all-on-4. In this case, there's 5 implants, and then the bridge is actually affixed to the implants, and it's like having natural teeth almost.
Actually. And do you take these on and off, or do they stay?
So those ones that you just saw right there, those are actually screwed into place, and you don't remove them. Okay, you go in and have your teeth cleaned twice a year, once a year, whatever, and they'll take them out and clean around the implants and then put them right back on.
Yeah, and you still need to treat them like regular teeth, right? You don't treat them just because they're not your teeth. You still need to clean them and get checkups and stuff, right?
Exactly, exactly.
So, I mean, what do you find out more people getting these implants? Why do you think, is it because of their health? Is it because of just, you know, bad, I might as well say it, I'm one of those people, bad, you know, dental practice?
I mean, you only have one set of teeth. You know, you can't replace you're not like a shark that has multiple sets of teeth that just keep coming in. So, you know, if they're gone, then you can't chew very well and you can't live a very functional life.
Yeah, and it starts to hurt more. All right, so we've talked about it. You want me to come in, and like I said, I've been a little scared about going to the dentist. Now, is there anything I can do to fool you? Can I paint my teeth? And you're like, oh my God, look how beautiful these teeth are. Can I do anything to fool you? Because I'm gonna get in there. You're gonna see some cavities. I know it. So.
Well, you can't fool me, no.
No. So
we'll take good care of you, I promise.
yeah, so that's what you want to do. It's TLC for gums, and Dr. Wilson's team is ready to take care of. Tell them how they can get a hold of you.
You can call the office at 480-661-GUMS, and that's 4867. Or you can visit us online at TLC, the number 4, gums.com.
There you go. Dr. Wilson, thank you. And we're going to set my appointment.
Right.
I'm laughing because he's looking at me going,
let's record it.
That's right. We're going to record it, and we're going to show you how they do take loving care of your gums out there at TLC for Gums. So thank you, Dr. Wilson.
Thank you.
All right, stick around. We got more there on Daily Mix right after this.